Marty, if you would have handed back to Phil, I've regained my composure. You were mentioning that, okay, I, for example, have assessed certain things that I'm not at risk of contracting, certain kinds of diseases because of my lifestyle. I'm not going to get them. I'm not worried about contracting HIV. Not going to happen, okay? So I should be able to opt out of that coverage. Doesn't that kind of violate the whole concept of what insurance is, though? Wouldn't the argument be, wait a minute, we're all of us in this room are paying insurance premiums to cover us for various things. This individual might be hurt in an automobile accident. I might be hurt falling down the stairs in my home over one of my kids' toys. You might be hurt taking a walk around the neighborhood and slipping on the ice. If we start letting people eliminate things that they don't think they're at risk of suffering, doesn't that kind of destroy the concept of insurance?
No, I don't think it does, because, you know, why should I have to have the actuarial calculated risk in my insurance policy for alcoholism when I'm not an alcoholic?
Same reason that the alcoholic is paying for something that you might subject yourself to that he doesn't.
I mean, you can build the risk. You know, if you decide that there's a reason why you need to have a substance abuse calculation into the risk of your policy to have that covered, then fine. Your premium will just be more, but you'll get the coverage. I don't feel that I need to have, you know, the use of these illicit drugs built into my policy so that that insurance company is covered for their risk and that they can make a reasonable profit. You know, I don't need to have, I am not in that population, and what I am exposing myself to is it's like across the spectrum of risks.
Okay. Mike, fire away.
Well, I think when you're talking about risks too, it's kind of fun because some of those mandates, I think we could eliminate. Because most people don't know in Minnesota, there's a few of us that could use one of those mandates. It's a mandate for hair prosthesis. And we all ought not be paying for that. We just ought not be paying for it. There are ridiculous things that are in there. The other thing I would tell people when you're out selling it is, what makes you think that a government that can't run a program like Cash for Clunkers can run a good medical system? It just doesn't even equate. And what makes you think that rationing isn't going on today based on what's happening? Has anybody ever been in an accident or something with work comp and you're waiting for 6 weeks, 8 weeks to get an MRI? That's rationing. That's happening in our current system because of the way the system is structured, because there's so much government involvement. And quite honestly, the bottom line in Minnesota, we don't have a problem. Marty was right. 92% of Minnesotans are covered, and statistically, you can't get that other 8% covered. They don't want government intrusion in their life. They don't want to sign the paperwork. They don't want to do anything. And sit down with the doctors and nurses. I got to sit down last week with doctors and nurses, and these guys were all right on. They were saying that those people that we give, and we give non-working people a Cadillac policy. What the heck is wrong with that? And they're using it. These people are telling us those people that get free health care are in the clinic every day of the week for every pain, wasting the emergency room, wasting the doctors and nurses, and that is why mandated medical care will never work.
Paul, how does Governor Kohls sell to the people of Minnesota? We're not taking the money, we're not taking the health care, even though it's there, and it's free.
Well, as I said before, it's your money, it's not free. But you know, the first thing is that we should acknowledge that that's going to be an incredibly challenging thing for any one of us to do. And the first thing we need to do is we need to continue to encourage all of us as elected officials and all of you as citizens to be active as you have been over the last couple of months to prevent that result from even happening. I sure hope that Governor Kohls never has to make that decision. And we have seen people wake up to the concerns that government taking over your health care, government getting between you and your doctor, what that means for you as an individual, for your health care. So I think the first thing that I'm going to do today, even before I'm Governor Kohls, as candidate Kohls, is I'm going to plead with you, let's make sure that none of us have to deal with that situation. Let's keep the pressure on the federal government. If that does come to pass, I think that we sell it to the people of Minnesota, as some of the others have said, you know, we have the best quality health care in the world here in the United States. And we have the best quality health care in the United States here in Minnesota. And what will happen, the inevitable result of the federal takeover of our health care, is that quality will go down. I don't think any one of us want that for ourselves, for our children, for our parents. That's how we sell it.
Pat, you're facing the argument that, wait a minute, yes, it is our money, we pay the taxes, but why would we send the tax money to Washington, D.C.? North Dakotans are going to get theirs, people from Wisconsin are going to get theirs, people in California are going to get theirs. You're not going to take ours? How do you sell that?
I think we need to be much more realistic here. There's still the proposals in Washington are still evolving, and I think they'll continue to evolve, and hopefully they'll evolve to a long death. They will, if they pass something, they're going to throw this into the federal tax code. And they're going to tax businesses, they are going to tax individuals for this, and it's going to ultimately turn into a single payer. And so it is not something that, frankly, that we can just opt out of. I don't think it's going to happen. I think they are going to make sure that whatever they write, if they can write and pass legislation that nobody can get out of it, and they'll do it again through the tax code. So I don't think it's realistic. I think I'm with Paul. I think we've got to fight this fight. The federal government is dealing with the wrong problem. The problem is costs of health care, and you don't solve that by trying to create a program that is deals with access and arguably quality. And so they're fighting the wrong fight. From a cost perspective, it's all about getting rid of mandates. It's about having competition. It's about posting costs for individual providers, getting back to HSAs and so on. And we're moving that direction here in Minnesota. But we also, the legislature and the governor, have passed an incredible number of mandates. That's why there's only 5 insurance companies in the state that you can buy health care from, essentially, because of what's done at the state level.